what other things would you say if you were talking to the pharmacy world today? What stuff should they be doing? What specific, if you just had to tick off maybe 4 or 5 things that they should be doing, what should they be doing?
For those who have not adopted adherence and medication synchronization as building blocks for their pharmacy, that would be job one. We are finding, so other things that pharmacies are doing that we think position them well, and we see it really, especially with the COVID vaccines, are vaccines, immunizing. Our numbers show that about 75% of pharmacies do flu vaccines, which means that there's about 5,000 pharmacies that don't. Good news is 15,000 do. Bad news is 5,000 still don't. When we're talking to government officials about the COVID vaccine, they've had other conversations with the big chains, CVS, Walgreens, and these government officials, we're having to convince them otherwise. So they want to use a CVS Walgreens because it's easy, and CVS Walgreens has said, hey, all of our pharmacies give immunizations. And so we're going back to those same officials saying, look, you've got 15,000 independents that give immunizations. Being able to give an immunization is a competitive advantage, especially in a COVID world. Not there yet, but coming are social determinants of health. So social determinants of health, independents are uniquely positioned to be able to capture different attributes, different things in that patient's world that lead to better or worse health, often worse health. People are finding that those can make more of a difference in the patient's health than even things like, eating properly or exercise, or that they're just as important as exercise or eating properly. And so the more advanced health plans, the more advanced health thinking is saying we need to understand these social determinants and we need to capture those and then solve for those, because until we solve for those, it doesn't matter how many tablets we throw at the patient. It doesn't matter how much money we spend on this patient. If these things in their life, their day-to-day life, aren't solved for, the rest of it's not going to matter. And so pharmacists can be, especially independent pharmacists, can be instrumental in that. What we're still trying to figure out is how do you systemize that? How do you document for it? And how do you get paid for it? But because it's such a powerful, has such a powerful impact on the patient's health and the costs of health, there's a lot of work being done to figure that out. So I think that's some, green field for pharmacists, or especially for independent pharmacists, as those things get figured out on how to capture the social determinants of health.